Right now, across New York State, the country, and the world, we are facing a crisis not seen in a century. It risks the health of our families and those of our fellow Americans, as well as our economic present and future. We are at the edge of a precipice, and lives are on the line. It poses a deep challenge to our collective psyche. How do we defend against such an overwhelming danger? How do we overcome our fear? If you're a person who looks to history, you may turn to great leaders of the past. If you're a veteran or serving in our military today, you might look to your training. We are at war with this invisible threat. How do we create the right strategy, tactics, and assault plans? If you're a person of faith, you might turn to Scripture. The book of Ephesians tells us how to fight against such fear. Put on the full armor of God so that when the day of evil comes, you may be able to stand your ground. It calls us to take up our shield of faith, wear our belt of truth, and stand firmly with our feet fitted with the readiness that comes from the gospel of peace. Regardless of where your inspiration comes from, in times like these, we are afraid. And we need to be brave. We need to be selfless, and we need to be courageous. We have to look inward to find our inner strength, our resilience, and we have to use our God-given common sense. And we need to fight far harder than we could ever imagine. Our enemy's clear: a novel coronavirus that is at our doorstep and taking lives. Our mission is to stop the spread, protect the vulnerable, and ultimately prevent future outbreaks. Every blocked transmission is a victory. Our frontline defenders are our doctors, our nurses, our first responders. Our National Guard is rightfully being called in to support these actions. To defeat this enemy, though, we need far more support. Mothers and fathers, sons and daughters, and all caregivers are going to be essential in limiting the spread of this virus. We need them added to the front lines today, all of them. The House passed a bill last week that takes a first step in the beginning to address these needs. It provides mandatory emergency sick days and up to 3 months of coronavirus-related paid leave for some workers. This puts us closer to helping those on the front lines of this crisis, so they no longer have to face the impossible choice of whether to stay home to care for themselves, a child who's home from school, a loved one who's sick, or risking public health to put food on the table for their families. Unfortunately, the bill falls short. First, over half of the private sector workforce was left out of the paid sick and family leave provisions. Let me say that again. Of the over 100 million private sector workers in this country, over half will not be helped by this bill. Companies with more than 500 workers are not required to provide any paid sick leave, and the administration can give exemptions to companies with fewer than 50 employees. Taken together, this could amount to exemptions for about 75% of workers. Worse, it fails to take care of many of those who are most at risk, low-wage workers. These are the workers least able to afford to take a day off, let alone weeks to self-quarantine. In order to fight this crisis, we must slow the spread of this virus and ultimately stop its transmission. We must provide paid sick days and paid family and medical leave to every American worker now. There can be no exceptions or carve-outs, especially not for the wealthiest companies in the world. For anyone who says this can't be done, they couldn't be more wrong. We should never send armed forces into battle without a plan, the right equipment, and the resources they need to win. If we don't equip all our frontline defenders, including our parents and caregivers, we will fail to limit this spread. Second, it's clear that in a matter of days, most public school children in America will be out of school. The stress this puts on working parents is truly hard to articulate with or without guaranteed paid leave. Many low-income children rely on school meals for their best meal of the day. School lunch can often make the difference between being healthy or being malnourished. Therefore, we need a surge in food stamps, food distribution, and emergency meal delivery programs. Third, we need a surge of testing. Without this critical information, we cannot reopen schools or businesses. To ensure universal free testing, we must authorize testing by all labs and hospitals and remove burdensome restrictions. From the start of this crisis, public health officials have uniformly highlighted the importance of widely available testing and decried our lack of it. As we've more fully grasped the magnitude of this crisis, states have developed their own tests, and their labs and hospitals are ready to conduct them. However, the approval process is still lagging. We are testing below our capacity because the FDA and CDC have yet to approve testing methods. This is not the time to let red tape stand in our way. The administration must authorize states to utilize their own testing methods in their own facilities in order to try to keep up with the spread of this virus. Again, fighting a war without facts on the ground, without critical intelligence, cannot prevail. We need this information yesterday. Fourth, I support Governor Cuomo's call to deploy the Army Corps of Engineers to build temporary medical facilities so that when hospitals are overwhelmed, we can move people into those temporary facilities. The federal government must work aggressively to help our states increase hospital capacity. Finally, and I can't emphasize this enough, every future policy that we debate here must put families and workers first. No half measures. These are the people on the front lines of this crisis. They deserve our unwavering support. Just like we give the troops the resources they need, we have to have the same war footing today. The very next piece of legislation before this chamber must extend full paid sick and family leave to every American worker. It must deal with the strain caused by the shuttering of our public schools, and it must increase our testing capacity and build more capacity for urgently needed care. We must pass it without further delay. Anything less will be a failure of government in this time of need. Anything less is defeat before the battle has even begun. This is how we fight. Every person we protect is a victory. This is our shared duty. God bless America.